I'm Phyllis Jackson. So glad you could join us for Stay at Home Connect.
Top federal health officials testify during a recent House congressional hearing on COVID-19 response. Dr. Anthony Fauci says he's concerned about the recent surge and believes the next 2 weeks will be critical to addressing the increase in cases. Florida, Texas, and California reaching alarming numbers. Fauci says the evidence of community spread is clear and warns the cases involving young people should not be ignored.
If you get infected and spread the infection, even though you do not get sick, you are part of the process of the dynamics of an outbreak and what you might be propagating inadvertently, perhaps innocently, is infecting someone who then infects someone who then is someone who's vulnerable. That could be your grandmother, your grandfather, your sick uncle, whom have you, who winds up dying.
Early data from clinical trials makes Fauci cautiously optimistic that a COVID-19 vaccine could be available by January of 2021. Imagine one test that can simultaneously check for 3 viruses. CDC Director Dr. Robert Redfield says the agency has developed such a test, which will tell doctors if patients have contracted coronavirus as well as 2 strains of influenza, A and B. And we learned during that congressional hearing that Atlanta's Morehouse School of Medicine will receive a $40 million grant from the Department of Health and Human Services. The money will be used to assist in the battle against COVID-19 in minority communities, which have been disproportionately impacted by the virus. Daniel Dawes is the director of the Satcher Health Leadership Institute and associate lead for government relations. He is a health policy expert and the grant's author. Tell us, Daniel, what this grant, which will be, as I understand it, spread out over 3 years, what this grant will do and how you will begin to execute this.
We're going to look at how many, African Americans, for instance, were denied access to ICU beds, right? Or if they did get an ICU bed, how long was the duration of their stay? Did we notice a disparity in terms of the stay? Did we see disparities in terms of folks getting access to remdesivir, right? These drugs that have been proven to ease the burden of this disease, essentially, right? Do we notice in testing that there is still a disparity? Are folks being able to access these tests, right, in communities of color? Will there be an equitable distribution of these resources, these vaccines, these tests, these drugs, these ventilators, you name it? So we're going to be looking at that.
Dawes says they will also look at the underlying comorbidities that lead to worsening outcomes, such as diabetes, cancer, sickle cell anemia, and heart disease. The National Infrastructure for Mitigating the Impact of COVID-19 within Racial and Ethnic Minority Communities Project will work with community-based organizations nationwide to educate and provide information on resources. The network will also link communities to testing, healthcare, and social services. Atlanta City Council member Michael Julian Bond hosts a prayer rally with faith leaders from all denominations. Organizers hope Pray Test will open the door to conversations on race, lead to social change, healing, and peace.
That's it for this edition of Stay at Home Connect. I hope you have a great night.